welcome to Hump Day Happy Hour, hosted by Dentists in the Know. This is the webcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We are pulling back the curtain on the industry. We're talking to the experts, the innovators, and the everyday clinicians who are out there doing the work. There's no fluff, no filter, and there's definitely no sales pitches disguised as education. If it's happening in dentistry, from clinical insights to regulatory curveballs, or maybe it's the latest scandal at the ADA, we are probably already talking about it. And yes, we are bringing the goods. It doesn't matter if you're a seasoned doc, part of a dental team, maybe you're in the industry, a curious consumer, or maybe you're just here for the banter. We welcome you all to the show because around here, we're not just in the loop, we are in the know. Hey there, Dinks. I'm Dr. Jeff Horowitz, accompanied by two amazing clinicians and even better friends. Yes, I'm talking about my dear friends, Dr. Chad Duplantis and Dr. Jennifer Bell. The three of us created this little platform to make the dental world just a little bit smaller, but a whole lot more fun. Today, I am totally fangirling, fanladying. I'm an Ann fan. We have Ann O. Rice with us today, and she's going to be talking about the oral systemic connection. Basically fell in love after talking with her for about 30 seconds because we just had so much in common. I got to introduce her for her course down in Mexico, and I was hooked from the second she started speaking. So lots of great stuff to get to. You're all going to be really, really privileged to listen to Ann and some of her insights on Alzheimer's and the oral systemic connection. So just great stuff. But guys, how are you? Chad, you having a little hailstorm there?
About to have a little hailstorm.
Because your connection is otherwise always so good.
It's good now.
Yeah, I can't imagine what's going to happen next.
Yeah, exactly.
Yeah. Well, how are y'all doing?
We're doing great. I got a little story to share when JB's done telling us how she's doing.
JB's got a whole new situation.
I know. Do you like the new?
I do.
It gives it more dimension. I just turned my desk to one other wall. So I have the wood wall that I've
But you're freaking me out, man.
I know. I'm just trying it out. Just see if I like it. You guys all have your bookcases and I got that boring wood wall. So I'm experimenting a little bit. You know, it's like college.
Hey, what if we put the bunks over here? So many activities we could do with all that space. Name the movie, Chad.
It's an idea.
So many activities.
That is
so many activities. Yes.
Yeah, okay, sorry. I was thinking about it for a second. Yeah.
How was your day? Tell us your story, Chad.
Yeah, let's hear it.
So this all comes back to dentistry, but we've been going through this new phase in our practice where we brought on an associate, which was it's been a lot of fun. It's been really rewarding. I'm getting to mentor someone, and then last week I was asked from Cabo to mentor a local doctor. And, of course, I have a really hard time saying no, but honestly, I'm very excited about it. We had a great first conversation. And, Jeff can probably tell you the two books that I told him to read before we actually meet in person. And I told my mentee that I want him to make a list.
Did he find his why?
Mm-hmm.
That's one of them, yeah. And the other one is Who Moved My Cheese.
Damn it, Sway hasn't made your list yet.
It's on my list to read. I'll have to share this with everybody later, but I'm writing a book. We'll talk about that later. Anyhow, so I'm really excited about this new opportunity to mentor somebody. But as we brought on this associate, I get to take a little time off. So this afternoon, I took the afternoon off. And, I've become really addicted to golf over the past couple of years. Like it's an obsession. I've got OCD to the major level and everything revolves around golf. So
when's your handicap going to come down?
It went up this winter, which really
I
bothered
was
me.
hoping you become addicted to this podcast.
Because
Yeah.
it's like one thing's going right, but something's going haywire. And I promise I'm bringing this back to dentistry. So this afternoon, I was like, I'm going to go meet with Simon. He's my coach. And I'm like, we're going to sit down and we're going to work some things out. So he's like, dude, your swing's great. And he's like, but there's a couple of things that you're doing and I'm not going to tell you. You got to figure it out. I'm like, no, dude, that's why I pay you. You're going to help me figure it out. And he's like, no, we're going to work through this. So he asked me a few questions and we worked through it. And he told me 2 things that I was doing wrong. We fixed those 2 things and then everything's like back to normal. And I mean, I'm really striping the ball really well. So I was really excited about it. But what it made me think about is that, you know, a couple of things. One is everybody needs to step away from the practice every now and then. Go get some me time. I mean, we have been go, go, go. We went to Chicago. It was nuts. I came back super energized about dentistry, and I'm still very energized about dentistry. But I do need me time, you know, and that was awesome. But the other thing is, as I was leaving today, I was like, you know what? There were 2 little things that are going to make my life on the course a lot easier. What could make my life in the practice a lot easier? And I think that through my mentoring position, I always say that I'm going to learn more from my mentee than my mentee is going to learn from me. And when I worked with a coach today on a hobby, I mean, it's a freaking hobby. I'm never going to join the tour or anything like that. It's just something that I want to be decent at.
You do know that.
Yeah, I know that. I know that. I've given up on that. I mean, I
Okay.
could
All
do
right.
some things. I could sell golf balls. I could probably do that.
Probably.
But there's a few things that I could do. But I think that we could all benefit from a coach or from a mentor because, you know, what we give, we get. And you know, I just took a lot of what he taught me today, and I'm like, you know, there's a couple things I could change in my practice too that would make things excel on a better level. And I hope that I'm a good mentor to the person that I've been asked to mentor. But I'm really excited about it because, like I said, once again, I will learn more from him probably than he will learn from me.
Yeah.
But I just think collaboration, mentorship, coaching, psychologists are very important in professional and practice life. You know, we heard a lecture last week or 2 weeks ago about suicide amongst our profession. And it hit home. I mean, I don't think there was a dry eye in the room at the end of that lecture. It hit home. And, you know, it's dentistry, as I said many times, can be a very lonely profession, but it's only as lonely as we make it. Go out, make friends, look for help, look for like-minded professionals, and life will be better. So that's my talk for today.
That was a great little message, Chad. I like that.
Surprising, but great.
Yeah.
Yeah. Yeah.
Powerful.
Well, let me tell you something. I was hitting my 5-iron 210 yards. So it's everything now is like, it's all gravy. It'll go to shit on Saturday. It'll go to shit on Saturday, but I'm good.
While you were having me time, I milked a parotid. So we had very different days.
That's kind of fun too, though, right?
It didn't suck.
It's all better than what my son, who is now on his pediatric rotation, just had to do. So, which I texted with y'all. Yeah, my powerful and impactful day revolved around having an argument with someone who would not let me off the phone until I called in a prescription for, get this, Polygrip.
You got to prescribe that now?
Apparently that is the case because he would not leave my office alone because he said, I just needed to call his pharmacy and tell him that he needed the Polygrip for whatever reason. I'm like, sir, this is an over-the-counter product. I was like, is it a full moon? And in fact, it was the blood moon.
Oh, yeah.
So,
oh, yeah.
Yes. So anyway, we have an incredible guest, guys. And, you know, you all got to meet her when we were in Cabo. I got to actually listen to her speak, which just kind of really got me excited and got me going about, you know, everything that it is that we do in dentistry. And becoming healthcare advocates. So I want to get to her, but we can't do that until JB does some news.
We haven't heard about JB's week though, so we need to hear a little bit more
I
about
milked a parotid.
She milked a
that.
parotid.
All you got?
Yeah, and I deprogrammed someone so well. Now I got to get Jeff to help me figure out how to solve
I can't
this
wait
problem.
to open that up. I was looking. I had the time yesterday to look at it. Today was just
I
whack.
know. I'm sorry.
Yeah.
You know how it is.
I know, but I'm excited to look at the case. I am.
And maybe can we do it together like live? Like,
Let's do it. I love it.
because
Let's
this
make
is
it a team campaign.
wild. Like
Yeah.
the MI pre-treatment, then 6 weeks into deprogramming, and then left unsupervised deprogramming for another 4 months.
Love those.
Kind of wild.
The really good ones are the ones that actually break the deprogrammer, continue to wear them, and then come back with the most effed up bite you've ever seen in your
Yeah.
life.
Yeah, we may be encroaching that.
Ask
but
me
she's
how I know
happy-
that.
She's happy as a lark.
I had a
Yeah,
lady bring me 6 occlusal guards this morning. Okay.
Yeah.
What?
3 of which I've made. All right. 5 of the 6 were broken. And I'm sitting there trying to figure it out. And I'm kind of puzzled. I'm like, I mean, they're broken in half. They're sheared off. They're all jacked up. I'm like, good God. And I mean, this is a former Air Force fighter pilot, female, very strong-willed human. And I'm like, what in the hell is going on? And then she looks at me and she goes, now, truth be told, I've dropped 5 of the 6. I'm like, okay. So this didn't happen in mouth. This happened on floor. Yes. Got it. All right.
I
There
mean,
you go.
even dropping, like how from a 27-story building?
I don't know, but they were very clean breaks. They were very
Or
clean
from
breaks.
her Labrador's mouth.
I was gonna say.
Yeah.
Yeah, very clean breaks. So, and the other
Right.
thing
She was
is
parachuting.
there was
Like, it seems
no
like-
no issue even at the discounted price. It was like, yeah, gladly. Here you go. Here's my card.
Yeah.
Yeah.
We'll take another one. Just,
All right. Carry
Here's
on.
some news, JB.
Okay, guys, you ready?
Yeah.
Some wild stories out there.
Mark it down.
Oh, I know
Okay,
it.
hold on. Now I have to do that. So you have to give me a minute. All right, thanks, community. Another weird and wily week in the world of dental news. First off, if I'm going to be totally honest, had no idea this guy was a celebrity dentist. So let me just lead off with that. But Dr. Stephen Lin out of Australia was shot and killed by police on March 3rd. Now, when I first saw the article, it was like RIP Dr. Stephen Lin. He wrote a book called The Dental Diet. He also hosted the Mouth Brain Connection, which is interesting considering what we're going to be talking about today. Yet something sort of spiraled for my man. Around 2024, got hooked on methamphetamines, and then ultimately was approached by police around March 2nd, March 3rd. We'll say March 3rd, Australian time, as he assaulted 2 women in their apartment. And then ultimately, the police tried to tase him first. He didn't go down. He lunged at the police, and then ultimately they shot him. It's kind of, again, I akin this to reading a board story where you read a story of a dentist who I think has all great intentions of doing the right thing. And you read the story and you're just like, and now we should stop. And now we should stop. And now we should stop. And they just keep making one bad decision, trying to get themselves out of the last bad decision. And it just sort of snowballs out in front of them. That's what I felt like reading Stephen's story. My condolences to his family and his wife, former wife, ex-wife, his patients, and all that, followed him and believed in him. He had a huge following, 250,000 people, which is shocking for those of us at Denison. No, but anyway, hate to see stories like this again. I think, to what Chad spoke about, a lot of mental health and addiction issues within the dental community, and we have to continue to shine a light on it and provide a pathway towards healing. a story coming out of the UK in the Telegraph talking about turkey teeth. Now, this story highlighted the fact that there's going to be this tsunami wave of folks that are going to need extensive dental care in the next 30 years, as those between the ages of 30 and 60 have gone to Turkey and other destinations to pursue treatment that they could get cheaper than their home country. And I think that's an interesting point to discuss. We haven't really been educated or taught how to solve or undo the things that we weren't really taught how to do in the first place. So I appreciate and applaud the Telegraph for bringing this to light to basically say, hey guys, in the next 10 to 15 years, this is going to be a real problem when these individuals have gone to countries to pursue treatment that you may or may not really be trained to manage. And it's going to be pretty complicated. And now what do we do? And as they age, can they go back to where they had it done the first time or not? So I think I don't have necessarily an answer to this story, but I definitely have an editorial comment to say, if we're not looking at this and studying this to help our general dentist colleagues deal with these individuals who have gone to foreign countries to pursue treatment, now back in our office, and maybe it's a hard stance. I don't know where the line will be, but we're going to have to be prepared for the fact that we're going to have these very heavily restored and complicated restoration patients that are going to be looking to us for answers that we may or may not be ready to provide. Another update from Florida. Yes, third or fourth week in a row, we're going to talk about that dental health aid therapist coming out of Florida. It was ultimately defeated, as was predicted by many of my colleagues in Florida. So great work rallying your team behind you. We'll see if this continues to hold. I think this has been a pretty consistent performance. We've got a few people within the House that really want this to happen, and then it doesn't go much further than that. But you know how these things go, having lived in a state that just got beat down year after year after year until ultimately they found the loophole. I want to be optimistic that Florida will stay strong on this. I want them to be the beacon of how we can engage workforce in creative strategies that don't diminish the people we already have, the dental hygienists, the dental assistants, and the dentists working together in this really collaborative process. So the fight continues in Florida. Last story of the evening coming out of California. A couple different stories. You know, California has recently brought to light a couple of transparency acts really requiring or wanting to require insurance companies to be more transparent about benefits for in-network and out-of-network doctors. So I'm really optimistic. I hope it gets passed because I think as California goes, so will the rest of the nation, and that would be a really helpful one. There's also a lot of new squirrely language coming out about extending licensure to foreign trained dentists. We're watching this one really closely, particularly in a state which I think many would argue in a lot of areas there's an oversaturation of dentists looking for jobs. Think about this. I think it has 5 or 6 dental schools. I have lost count at this point. Really flooding the market with a lot of dentists looking for jobs. So now we're looking for fast-tracked opportunities for foreign trained colleagues as well. We really need to be watching this pretty closely. If this is supposed to be solving workforce issues for dental hygienists, could be an interesting discussion. We're seeing the same thing in Virginia as well. So this is a topic that keeps bubbling up to sort of deal with the dental hygienist shortage that we're currently suffering from. I think we may have to come up with more creative solutions, but time will tell on that. And with that, that's the news.
Really glad you hit on Dr. Lynn. That was a sad story. Just a odd.
It's kind of bizarre, the whole thing. Actually.
That actually happened to a classmate of mine who was the nicest guy ever. And oddly, I was looking into, what happened to him because he was much older than us when we started dental school. And it was about a year or two, I was looking into, whatever came of him, did this great implant continuum after dental school, got into the business side of dentistry, kind of left clinical, went into teaching. And then all of a sudden I read this crazy story that was very similar to Dr. Lynn's. I was like, oh my gosh. I mean, mental health is an issue in dentistry.
Absolutely.
Huge. Well,
guys, Guys,
Yeah. And gal.
I'm excited.
The Ann fan is ready to
the
geek
Ann
out.
fan is ready to go here.
All right.
So
introduce.
we have a formal introduction for this amazing hygienist, but I'll read you a little bit from it, but then I want to also offer some insight. Ann O'Rice has been a clinical dental hygienist for 35 years. She's a speaker, she's a writer, she's a consultant, but she's done so much more. She created oral systemic seminars in 2017 and devotes much of her time, focus, and studies to dementia prevention. And this goes so far beyond the basics of being, a preceptor for Bale Deneen and just, the early understandings of the oral systemic connection. She's really taken it to a whole different level. She's a certified dementia practitioner, and she's a longevity specialist with the Alzheimer's Research and Prevention Foundation. And she's also developed curriculum for them. She's a fellow with the American Academy for Oral Systemic Health, and she serves on their advisory board. She does columns for RDH magazine focusing on oral systemic health. She was a recipient of Sunstars Awarded Distinction for research for her 2021 manuscript, Alzheimer's Disease and Oral Systemic Health for Frontiers. She's recently joined the faculty for the Institute for Functional Dentistry, and she's also been included on the International Consortium of a diverse network of brain researchers, clinicians, and institutions that support Alzheimer's prevention. Her consulting has brought her to Cornell's Alzheimer's Prevention Clinic. She's worked with Florida Atlantic College Center for Brain Health, the Atria Health and Research Institute, and the Institute for Neurodegenerative Diseases of Florida. Now, as if the resume wasn't enough, I got to meet Ann because she was one of the speakers in Cabo when we were down there for Ada Aspire. Met her briefly the night before I was going to be introducing her. Maybe it was 2 days before, but I met her the first night. And as soon as I started talking with Ann, I was like, this is someone that the industry needs to know more about.
She actually immediately came over to me and asked if I would do the intro instead.
Yeah. I can understand why.
And she asked, totally is that guy as scary to everybody as he is to me? And we're like,
yeah. And I handed her a handkerchief and asked her if it smelled like chloroform, and she just
it was weird.
It was a weird interaction, but no. As soon as I met Ann, I could really see the passion in her, and that's always uplifting for people like us. I think, Chad, you were talking about this with your mentorship, that sometimes you just meet people that make you want to be better and make you want to think on a higher level. So it wasn't just about that night. It wasn't just about the introducing her for her course. I sat there and listened to her course and was mesmerized. And what's really interesting about her course was that it was really in the title geared towards a more female audience. And she has a lot of great research and information because women have been so overlooked as far as medical diagnoses, particularly in the arena of like sleep apnea and other diseases. But as I sat there, there were a few guys in the course besides myself, but at the break, we all ran out and just started telling other people. And then, after the break, it was just all these guys who, were probably a little afraid from the title are now like, oh my God, this is the best thing I've listened to, this year. And so, Ann, I just want to say how much I appreciate your passion for what you do, for bringing so much attention to the oral systemic connection and neurodegenerative diseases and how we as dentists can have such an impact on that. So welcome to the show. It's really exciting to see you here tonight.
Thanks. With that intro, I want us to just cut it off now and say thank you very much and let's move
Exactly.
on. That is so good.
Peace out.
I appreciate it. Yeah, I'm done. Mic drop. We're at the end of it. So, yeah, we all met. That was a wonderful event. I didn't know what to expect. Of course, it's Cabo, so I did have expectations of relaxation, but everybody was really nice. And when you talk about the course based more for women, obviously it's for everyone, but I would say that all of us have a woman in our life of some way, whether it's a daughter or a partner, we have parents, a mother, that this disease, 2/3 of the cases obviously are women. But what's interesting about it is the care providers. There are millions and tens of millions of people that are the care providers of somebody with dementia, and then those are women. So even in the practice, and I try to mention this, and I hope I did it there, is that in your practice, just right out of the gate, you have a patient that comes in and she sits down and says, oh my gosh, my mom, we've had to move her in, or she has dementia. We just don't know what it's about. That is, your ears perk up. And then that's where we're going to go. Let's look at this patient's oral health. We're going to be more tender. We're going to pay attention to things. Eventually it'll get to the point that they're going to be ordering groceries from home. They're not going to the gym anymore. Can they leave? Then they're at risk. So it's a big, dentistry is filled with women, and half of our patients and our loved ones, not to be negative and down about it, but all of us are going to know somebody in our family that has some sort of dementia diagnosis. Now there's a million different causes to that. We can have the big Alzheimer's or Lewy body that we see in the news. Not as common, but there's vascular dementia, because remember, cardiovascular disease is still the number one killer for both men and women. Obviously, you have poor vessel health. If you have poor vessel health from here down, you have poor vessel health from here up. And so your cardiac situation is going to affect your brain as well. So lots of different dementias, but lots of different things that we could do in prevention. We have to stay positive about it. My history of why I'm so passionate, it was back in 2017 that I really started, I wouldn't say beating the drum. There was a lot of pushback. I read a paper, it's happening in my family. There was one little sentence in there about oral health as a important modifiable risk factor. And I just went all out. Obviously, I'm not a neurologist. I had to learn the difference between a synapse and a neuron and all of the different things. And so I really focused in that. And, you were talking about people that you meet and mentors, and, this industry is very small, but yet it can be very large. And I always want to have people in this siloed dentistry, we could get into a whole conversation about the silo, but that we have tentacles that can go out into medicine and into different areas. And if there is an opportunity for you to share information or learn information from outside of this world, it's important that we take those. And that's exactly what happened to me. Dr. Martha Summerman with I think she was with the NIH at the time, from one person I met this person and so on and so forth, said, hey, I'm doing this journal in Frontiers and I want you to write a paper. And that's where I wrote it 2020-ish. It got published in 2021. I really ponied dentistry up, that we could change the trajectory of Alzheimer's disease. And I make the joke that, that those papers were only 3,000 words. And that's clearly not enough. Obviously, you all have met me, so you know that that's a lower level for me. But I tried to put in there all the different things that we do in our offices that make a huge impact. We always are, and we'll talk about slaying the bacteria, right? That's important. We have a bacterial infection. It goes systemic. I mean, that's crystal clear. We don't need anybody to tell us about that. But there's a million other different things we do. And of course, a lot of y'all's focus is in airway. That's a real significant factor, but we need every dental person, whether you're doing, as I like to say, the plastic appliances or not. That really, it doesn't matter if you're actually moving forward there. You get assessments done, you refer them to have these home sleep tests. We have so many different avenues now to assess somebody's airway and breathing. sleep, oxygen is clearly important for the brain. So, and then I put other things in diabetes. You know, we know about sugar and periodontal disease. And of course, those patients are more susceptible to diabetes and higher A1C. And then lots of, even this is just simple. This came out last fall, maybe last summer. Interesting. I am not a diabetic. However, if I had periodontal disease, after I eat a meal, my blood glucose is going to spike higher and be elevated. That's periodontal disease for you. So I'm a normal, I don't have diabetes. So we see all of these relationships between periodontal disease and every system that I have. And so, yeah, I got passionate about it and kept trudging along, and had some good opportunities outside of dentistry that really filled me up. I am so lucky that I get to sit in meetings with incredible experts, and I can just sit there and listen and soak it all in. Read science all the time, and which microbiology was my least favorite when I was in hygiene school, but yet here we are, as they say. So yammered on enough. What else do we have? What do you want to ask?
I have a question for you.
Sure.
Do you work at all with Dr. Ed Zuckerberg?
I do not. I do not. I understand his, yep, I know all that. I do say that my mentor and my boss, so to speak, I think they have a little bit of a relationship. Everybody is different in this world, but yeah, I know that he is supportive, and
we need to make that connection, because
a PG,
when he showed those studies, I mean, I think it definitely blew me away. And I think I can speak for Jeff and Jennifer too. I mean, you know, we had him on not too long ago, and I mean, he's got a great way to test for these things that can actually increase dementia. But, you know, of course, you know, you hit the nail on the head, but I mean, a lot of people don't realize how closely the oral flora is related to the issues with, you know, dementia and Alzheimer's.
Well, and I think it gets kind of complicated because everybody wants, let's take cardiovascular disease. If I had a donut tomorrow morning and had a heart attack on Saturday, did the donut actually cause my heart attack on Saturday? Probably not. It was all the donuts that I ate before that led me to more cardiovascular risk. People want a causal, this is this, it's a one. We don't have that in any disease, that it's a one thing, right? So people really try to do this oral health thing. Is it causal? Is it not? No, we can't. It's so many different things, right? It's a contributor. If I don't exercise, cardiovascular health, which I will say goes into brain health as well. So, yeah, the pathogens and PG is a big, we study it a lot. But yeah, that's a big contributor in the cranium.
Yeah, there's so much out there that I think is, you know, we just plead. I shouldn't say we plead ignorance to, but we don't know, because I don't think it's been brought to our attention. So we're very thankful for people like you that can help bring that to the attention of dental professionals. And we need to figure out how to get your messaging out more.
Yeah, I think that what a lot of people, I'll tell you what the pushback is. So we all went to college. I was in the 80s, for heaven's sakes. I learned a modality of the 80s, and I do this with a cardiologist. If my cardiologist was doing treatment from the 80s on me, well, I'd fire him, because we have new modalities, we have new information, but we always have to.
Dead end.
Yeah, I absolutely would be. Absolutely. Hopefully they'd wear gloves, but anyway,
Yeah.
Nonetheless, I think that there is so much new information that comes out. How do we distill this down easily? But the basics that I see sometimes in my own hygiene world is that if you're trying to treat this bacterial infection, periodontal disease, with bacteria, you got to understand the mode of action. You got to go back to microbiology. I could tell my patient, I need you to, which is not what I recommend. I need you to swish and spit with this. I'm going to scrape the side of your tooth like this. But if you don't really understand what the modality and what the new science is, it falls flat. So I think that it gets a struggle in both of our, you're in the dental world. I think dentists the same way. I mean, I don't know how many classes you all even took about periodontal disease and some of gram-negative bacteria, but we got to go simply back to some of the basics about how gram-negative bacteria actually work. Obviously, it goes systemic, but we have to understand the way that that works. We pick a red complex. Listen, red complex, Kransky hadn't put them in that color code when I was in school. So there are plenty of clinicians that are 60 years old that never heard him, Hashinagallis, never heard all of this new information. So we have to not necessarily reteach, but we have to go back to the basics. So we have as I said, a gram-negative bacteria. They have these little bleebs that come out from them. We call them outer membrane vesicles. They can go everywhere. And I use the example of, I order something online from China and it comes in on an airplane, right? That's my gram-negative bacteria. But in order to get to my house, an outer membrane vesicle, an Amazon truck drives to my front door. So these outer membrane vesicles carry the bad things, lipopolysaccharides, gingipanes, which a lot of your community has heard about with PG. Then what does that do? So now it's circulating, it's everywhere. Bacteremia is in the bloodstream, it's going through nerves, it's everywhere. It gets into the brain quite simply, crosses the blood-brain barrier, which is trying to help keep crap out of the brain. And then it starts inflammation in the brain. It's just like my body. Inflammation with my inflammatory cytokines, we're doing the same thing upstairs. So I think if we go back just a little bit and take one 30-minute class back into microbiology to understand really this oral systemic and how those pathogens kind of work. You all are airway people. So you did a pathogen test, right? We have these gram-negative bacteria, we have some orange complex, we have all these things. And I see on one of those Tannerella forsythia, and it hits like a freight train on that. I am going to look at my patient and ask them straight out of the gate, do you have an airway issue? Because that's what I know about that pathogen. So everything leads to common denominators, and then all of those things are risk factors for brain health. So you have to use critical thinking skills. We got to teach more of that, right? When you see this, you ask this question and you're a little bit more curious.
I have two questions.
Yes, ma'am.
With a patient focused one first. I'm watching this podcast and I am pursuing optimal health. Like I'm biohacking. I want to prevent all the disease processes that you're talking
Perfect.
about. What are the tests? Who are the type of doctors? Both dentists and MDs that are going to support. I know you laugh because I'm laughing internally as well, but let's just pretend for a second I'm a 30-year-old patient who's hearing what you have to say and go, I want to biohack because my parents, grandparents have all had that disease. That I don't want that to be me. So if I go to my doctor, what are the tests that I'm asking for and frequency at which I'm monitoring that and treatment modalities that may support that? And then there's a follow-up question from that.
Okay. So I wouldn't necessarily go running to my doctor to give this arsenal of $3,000 worth of blood work. Do it on your own. Let's check out your own self first. Let's do some good, healthy diets. That's not going to be trending diets necessarily. The 30-year-old doesn't have an ailment right now. So this is somebody that doesn't have a situation. Okay. They're going to eat a healthy diet. They're going to exercise. These are across the board, hands down. This is what you have to do for a lifetime, period. You're going to reduce inflammation. You're going to keep your weight down because, by the way, obesity, adipocytes, is an inflammatory process and your cytokines are through the roof. Everything that you want to do to keep the whole body healthy, you're going to actually do that for the brain as well. Some of the medical tests, the medical areas that we really want to keep in check, we need to keep our glucose in check. You can do this by A1C. You can do this. You can do a glucose monitor now. What do I have a spike? How can I change my eating? I don't want to get big spikes and stay elevated. I want my glucose in check. Your brain runs on it. You better have the insulin cramming it into your cells. When it needs the glucose, it better be fired up to be able to get into the brain. So I don't want insulin resistance. I want that regulated. I need to do exercise. Exercise does everything. It's going to keep our blood pressure down, keep us not overweight. It's going to help in a million different ways. Hypertension, midlife. This is the 35-year-old, 35 to 50, doubles your risk for Alzheimer's disease. You are beating your vessels. You are causing disruption to your blood-brain barrier. And we have every medication in the world. The American Heart Association, the cardiology groups are now saying, listen, if you are not within a normal range, normal is not optimal. That's a whole nother discussion. 120 over 80, 115 over 75, do something about it. And if you can't get there, they want to start medication much earlier. We need to watch our pregnant women. You're a 30-year-old woman. You're going to be getting pregnant. We don't want you to have hypertension during pregnancy. We really need to move in an area, because what does that mean when you're pregnant with hypertension? You're probably going to have hypertension later. Okay. All of the things, of course, your mouth. I mean, this is really simple. You got to keep it clean, go in regularly, go in more than regularly. If you have an ailment, we always talk about this, don't chase diseases. Are you going to chase your hypertension and not take your medication? Not doing a DASH diet is an excellent diet. Drop the salt. Don't eat Cheez-Its anymore. There's too much salt in most of those processed foods. Try to work on different areas that you can do at home. Cholesterol is, and I won't get into the sticky wicket of cholesterol during this conversation. It's complicated. Why I get people sending me emails all the time. I'm not taking a statin because it's going to cause me to have dementia. Quite short-sighted. It's not exactly the way that works. Everybody has their thing, but keeping cholesterol is not just LDL and HDL. Okay. Those are, yes, bad and good. We have a lot of other parts to cholesterol. We have oxidized LDL. That's no bueno. We have different particle size. So really for me, when I go to my cardiologist, I actually ask him for a little bit more. I need inflammatory markers. I need to know my homocysteine. I need to know myeloperoxidase. I need to know a few of those other things other than my LDL and HDL. I will say, and I don't know if you have show notes or anything like that, there's some new opportunities that have come out for anybody that's viewing it. If you go to the website ind.org/learn, this is 10-minute modules. Anybody with ADHD can get through this. We're going to talk about the heart, Dr. Isaacson and some of the other team there. Talk about the heart, talk about the gut, talk about this, talk about that. All of the risk factors, and they're in little 10-minute modules. No one that is listening to this would not know how to reduce risk if you can go into those modules. Here's the other thing that we have out there now. It's called Retain, T-A, not train, retainyourbrain.org. It's a free app, okay? You will key in different things about yourself. Are you overweight? Do you exercise? How's your sleep? La, 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 la. They're going to ask you a bunch of questions. And then there is an oral health section, which I scored 101%, I would like to say. And then what we're going to do, this app, I didn't cheat. I might have embellished.
No, I said
a
such an
little bit.
overachiever.
Oh, I thought you said I cheated. Well, if you only knew. So what that will do is it'll take all your data together, and then it will spit out perhaps in ways that you can improve. It'll ask you about diet. Maybe it's going to tell you, can you up your antioxidants a little bit? Try some berries today. How about HIIT training? How about this? How about that? Eventually, and probably in the next 3 months, we'll be able to insert your blood biomarkers. So your doctor is going to tell you what your A1C is. Your doctor's going to tell you what your cholesterol is. And then you're going to input that. This is free. This is not nobody charging. If you go, you're asking about, who do I go to?
Is that it? Retainyourbrain.com?
Yeah.
Okay.
Yep.
Okay.
That's it. Where do you go? I don't have those answers. I live in a big city. I live in Houston. I don't know, fifth largest city. I don't know that there's anyone really here. The first preventive neurologist was Dr. Richard Isaacson. The second is Dr. Kellyanne Niotis, who's back now at Weill Cornell, because he trained her. Preventive neurology isn't, neurology may not embrace this. They're getting closer to it, right? You have to do your own education. Does that make sense? Be an advocate for yourself. Say that your mother is 80 years old and, oh my gosh, my mom just started forgetting things. Let's get in. Let's try to figure out what's going on. And they're going to do a brain scan of her. They're going to do an MRI. And they're going to see these little white matter disorders in her brain. And here is what they're going to tell you 90% of the time. Grandma's just aging. That's just a normal part of aging, Grandma. Nope. No. We want to get ahead of that. We want to do prevention strategies. Forgetfulness isn't a normal part of aging. Now, on the tip of my tongue moments, that's kind of normal. Those things happen. When I'm not getting good sleep, you Airway people, obviously, I'm wrecked the next day, right? There's a lot of things that can go with this. If grandma, your mother, whomever, is forgetting things, don't put her on the Alzheimer's train right out of the gate. Okay? Dial that back. Don't give her a diagnosis. We're going to do blood work. How is her nutrition? Does she have a UTI? How is her water consumption? What about blood sugar? Have you ever gone hypoglycemic? You can't remember anything. So how is her sugar? You have to tease out some other things. So no one I want to go, oh my gosh, my sister's forgetting things. She's got, the disease, the Alzheimer's, whatever it is. There's a lot of different other things that can go into play. So that didn't answer it. Did it answer?
It did. And I think for dentists, because primarily dentists consume our content. So for dentists, including the three of us, who want to co-diagnose and co-work with our medical teams.
Okay.
To your point, also find that challenging. Because if you don't have, a preventive neurologist that you can refer to or, whatever, or you can discuss all these biomarkers and everything that you see, but then if you don't have a medical team that supports that process, then it can fall flat for the patient. So you probably don't have an answer, but if there's any success stories of where it worked really well or recommendations for dentists, like I am 100% on board with identifying and educating and getting my patients to participate in that process. But I can only do what's within my scope of practice.
Absolutely. And it is within your scope. And if
what do you do?
Nancy, your patient is now forgetting things. I
Right.
mean, where do you go? I mean, how do you do? Well, that's a family member situation first. You could have it. We have to remember with our medical providers, I mean, let's just be honest. They work a lot.
Yeah.
Like the ones that I work with, we do a lot of work on Saturdays. We do a lot of work at night. So they're very busy. Less words, dentistry, less words on those referral slips. You get cut to the chase. Does that cardiologist want to know that 4 and 5 millimeter bleeding pocket with exudate on? No, bless be. No, they're not reading it. So if you have this dialogue, find out in your community, you all socialize, have a lunch or who's your provider? Who do you go to? Do you like them? Do you trust them? There's an engagement right there. My primary care doctor uses that ind.org/learn for his patients because they don't have time to talk about brain things.
Right.
Always just encouraging, you might do, if you're doing an implant, you might do a glucose check before you place the implant, which would be a very wise move in this day and age with failures and biofilms and all the rest. So that is at 190. Okay, you have your own dental problem there, but then they also have a health problem. This is what we saw today, Mrs. Jones. I will send this to your doctor. You don't have to tell them that they're going to get Alzheimer's disease, but that's just one risk factor. Mitigate that. The other thing that dentistry has to mitigate is periodontal disease. Figure out how to treat it, diagnose it, and then figure out how to treat it. And by the way, dentistry needs checks and balances. Okay. So your endo, you do a root canal and then you put a crown on it eventually. And then some offices will take a PA in a year. You're checking the apex. Everything going good? Everything doing that? What about periodontal disease? It's not just about probing. Check the pathogens. Those pathogens are living in 2 millimeter pockets. Check your work. It doesn't have anything to say that you didn't do something right. It's just we need to know, right? There's a lot of things that I talk about. An AFib patient. Here's an example. You have an AFib patient comes in, checks it on your health history. An AFib patient to me is a high risk for cognitive deficits. The relationship between perio and AFib is an inflammatory pattern. And we know that if we treat periodontal disease, AFib reoccurrence is less. So you, on your health history, have an AFib patient, they're going to come in every 3 months. Hard stop. We're going to explain a little bit of that. We don't want any inflammation, Mrs. Jones. So we got to learn the information. There are checklists that I could have for anybody if they want to reach out to me. Check this. Cold sores. This is another one for dentistry. Super important that you are printing the prescriptions for acyclovir, valcyclovir, famciclovir, whatever your dentist choice is. I believe in famciclovir. It's 1 Mac Daddy dose. Talk about patient compliance. That's great. We don't want replication of that virus. We want to tamp that down as fast as they get that tingle. That is a solid dental thing that you can help your patient cognitively, and also just having a replicated virus is not a good thing. So no, I don't have easy answers to that. Learn your community, for heaven's sakes. Who are your champions in your community? And it takes some due diligence, obviously.
So one place, Ann, that I found some information and some people that I could work with is in the functional medicine community.
Yeah.
You know, these seem to be the people that, like what you said, that, you know, we have to also be letting our patients know that we're not just here to fix them, that there has to be some ownership taken, that there are contributing factors that are only under the patient's control, that are things that lifestyle changes, dietary changes, you know, that there's so many things that they can have, you know, impact on their own health. And that seems to be where functional medicine is going, is to say, hey, I'm not just here to hand you a pill or a fix or a cure. I'm here to kind of guide your lifestyle. And so for me, that's the only place that I've really been able to find a few practitioners in the community that are at least open to the conversation. They may not know it all. None of us do, except for you.
No, you know what I love about functional medicine is they focus a lot on the gut.
Yeah.
And dentistry is really, I'll watch my words. We aren't focused enough on the gut in
100%.
the mouth. So
Absolutely.
You're swallowing all the bugs. It's going there, right? It's surviving stomach acid. It's going everywhere. We're getting gut dysbiosis. And then if you go back to science, it's called the vagus nerve. Well, where does that go? It just went to my head.
Yeah.
Okay. So that's why I love functional medicine, because their focus is a lot of the gut. I have a colleague that is working with just a complete expert in this. And it's fascinating when we get the gut healthy, what happens to the mouth. And the gut was worked on.
From Bale-Deneen, the two primary sources of inflammation are the oral cavity and the gut.
That's why I do think that there's a price point issue with functional medicine sometimes for a lot of our patients. You know, that's not necessarily on their plan, just like in dentistry, it's not on their plan. But I 100% agree with you. Yeah.
Matter of compliance too.
Yeah.
Oh,
I mean, functional medicine requires vast compliance.
But this is the cool thing, Chad, is that usually the people that seek the functional medicine docs out, they're not going to be on their plan. They're not. Yeah. These are kind of the people that are already saying, hey, I'm ready to take charge a little bit. So
if they're paying for it, I've got 2 kids that don't follow the instructions. So I get it, but no, trust me. I get it. And I'm in full favor of it, but it's a compliance issue. A lot of people are seeking answers, but not necessarily willing to follow through with the solution.
So this is something really cool that Anne said during her lecture, and forgive me if I don't get the percentage right, but that it was something that you said that 60 or 70% of the contributing factors towards dementias were preventable.
It was Lancet, and it was less than that. It was about 46% in their recent.
I'm sorry.
No. It was in their most recent paper, which was in 2024. And so modifiable risk factors were the contributing factors towards Alzheimer's. So a lot of people think it's also this genetic thing. Remember that 60% of the people with Alzheimer's disease don't have that genetic marker that we all hear about.
That was where I got the 60% from.
Right.
And
so
then, but it stood out to me how much we actually had control over so many of the contributing risk factors.
Yeah.
Like even almost 50%, that's crazy. No one would ever think that.
What I do want to mention, and I know that we're short on time, but I want to mention this when we talk about, and it's something that I've learned in the last year, when I mention that about 46% in this Lancet modifiable risk factors, that is not to ever say that, heaven forbid, I get it, and that in any way the disease was my fault because I got diabetes, or I didn't pay attention to my heart, or I didn't exercise enough. In cancer, we don't do a blame game when somebody gets cancer. And I think sometimes when we now know the preventive strategies, we have to be really cognizant that, you may get it anyway, even with the prevention, but we still need to move in that direction, that we're very kind with our seniors, or, oh, well, he had a heart attack because he ate Biggie fries. Okay, we don't blame chronic diseases. And I just want to make sure that I didn't pay enough attention to that in years before, until somebody said, my mom did everything right. And so I just want to, throw that in there.
I think that's important on a lot of things in life. I think we've got to do our best at prevention. Mm-hmm. It doesn't mean that we're going to be 100% effective, but should we live our lives on, headed towards disease or trying to do the best we can to stay away
from
the
ship.
And I love that message. I think that's really powerful. And I think that, of course, we all get it, but it's true. We've got to do the best that we can to give ourselves the best opportunity,
Yeah. And you can right the ship, whether you're the 30-year-old that was the example, or you're my age, or you're 70, or even you're 80. There's lots of different things that you can still do. That it doesn't, don't give up the ghost because you're 70 years old. That is it, because you might have 30 more years in you. So
is there I don't believe that you answered this earlier, so I'm going to ask it again. If you did, I apologize, but I think it would help our audience. Is there a trigger in your life or your journey that made you just go down this rabbit hole?
Yeah. My mom started to forget things.
Okay. You did not say that earlier, did you?
No, I probably didn't.
Okay. I'm sorry.
I do mention it. No. I do mention it. She started to forget things, and I know that we're at time, but, she started to forget things. And of course, now I'm going to fix it, because that's going to be an easy thing to do. And then we're just going to get her on a better diet, and okay. So obviously that wasn't the case. And then I started reading more about it. And then selfishly, I didn't want it to be me. What am I going to do about it? And then started reading. And then that's when I hit that sentence that talked about oral health. And I went, okay, this I know about, this I can treat, this I can do.
Mhm.
And then it led from there. And she made it to, and I guess this is a good way to end this. So my mom passed away at 94. As delightful as she was at 40, 50, 60, 70, 80, people get the vision, and sometimes it is awful. I'm not going to lie. But think about another vision of some of our seniors that just forget things. They're goofy. They might say things like, "Anne, that looks terrible on you." Just some of the normal older population things. She was happy, delightful, smiling, fashionable, all of the things. And then she had mixed dementia. So she had vascular and Alzheimer's disease both. So just because it's in the family as some diagnosis, you've seen one patient. It's always different.
Mhm.
So there's also happiness on the other side too.
Awesome.
I love that. And I think it's a great way to end. And thank you so much for being here. I mean, it's so enlightening. My mind's reeling because there's so many things that you brought up that, we just don't think about on a regular basis. But I think I'm going to close with this.
Hey, Chad, I'm sorry.
Oh,
really
okay.
quick
Go
before
ahead,
we
JB.
close.
You go ahead. Do your thing.
No, I just want to make sure
seriously,
before we end that if folks want to get in touch with Anne or learn more about what she's offering, the information, education, how do they find you? How do they learn more? Dig in a little bit deeper.
It is my name, and you have to put ANNEORICE, and there's a website, or you could do Gmail. If you go to my website, you can send me a message through there. It's on socials. Instagram is really just for dog videos and goofy things, but I do put some things on there. But
Okay.
yeah,
You have
absolutely.
a beautiful speakers packet, by the way.
Oh.
Because I went and looked at it, and you did a really nice job on your speakers packet.
And I will admit that's an old one, so it is more stunning now. I just haven't put it in. So thank you.
Okay, you're welcome. Maybe we get her on for a webinar, JB.
Yeah, it's got to happen.
It's got to happen.
I've already made that decision, and
I love it.
I'll send you an email.
Okay,
I'll drink wine through that, though. Is that
send
okay?
me. Yeah, please.
Yeah,
We don't
Okay.
drink.
Solid.
yeah.
So
Okay,
Good.
Chad. Now you can close.
Now you
have
can
my
close us.
permission.
I can close? Okay, good. I mean, I kind of forgot what I was
Well,
gonna
you
say.
have been a little chatty tonight. I'm just gonna say that.
You know what? I'll shut up next week. Okay. How's that?
Yeah. No, that's all right.
No.
Right.
We like when you talk,
But
especially when you close us out.
But what I was going to say is this: if you've ever heard me speak, you've heard me say this before. Is that we need to stop being tooth mechanics and be physicians of the oral cavity. There's so much that the mouth can tell us about the body, and there's so much that the body can tell us about the mouth. Dig a little deeper, because even though we are just focused on the mouth, we can make a difference in lifestyle and life and longevity if we look for the right things. So dig a little deeper, be a little better. And thank you to Anne for sharing your knowledge with us. It was very enlightening, and I look forward to hearing much more from you down the road.
Mm-hmm.
Thanks a lot. Y'all are very fun. Oh my goodness.
Good night, everybody.
Yay! Another
Yeah.
one won.
Yes,
Yeah.
Most of y'all are really fun.
most of you.
She excluded you, Chad. It was awkward.
Thank
No.
you. It was awkward. Yeah.
Y'all are.
All right. Have a good night,
All right.
everybody.
Good night, everyone.
Good night.
Thanks, Ann. And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.